Performing a lumbar puncture. Establish trust relationship with patient and his parents. Explain the purpose and the course of the procedure. Get a written agreement to the perform procedure. Lay the patient on the right side, on the couch, the table or edge of the bed. Extremities as closely as possible to the body, the spine bended. Necessary equipment: needle with stylet, iodine, spirit, 3 sterile tubes with cotton gauze, plugs in stand, sterile tray, sterile wipes, sticking plaster, water manometer. Doctor's hands processing: first swab moistened with spirit, then iodine. Wear gloves. Mark the puncture place. Swab solid iodine. Connects by line the highest points of the iliac crest. This line processes spinosus of the 4th lumbar vertebra, upper edge of 5th lumbar vertebra. A puncture is performed between processus spinosus 3 and 4 or 4 and 5 lumbar vertebra. Processing of operation field starting from the puncture site, from the center to the periphery. At first iodine, then spirit. Wipe dry with a sterile swab to dryness. Left and right hands fix the position of the patient strictly on the side area box perpendicular to the surface of the couch, with turned thighs to the abdomen and with tilted head to chest. Fixes the assistant. Before performing puncture, need to conduct local infiltration anesthesia by Vishnevsky. Then insert the needle with stylet with cut-up. When you reach the subarachnoid space, feeling of failing, carefully remove the stylet from the needle, attach to needle manometer and record the pressure of cerebrospinal fluid in millimeters water column. Carefully remove the manometer successfully in 3 sterile tubes. Get 0.5 ml cerebrospinal fluid flowing from the lumen of the needle. After removing the needle place of puncture, to process by solution of spirit, apply a sterile wipe, fix on skin by sticking plaster. Write out a referral form. Mark tubes with cerebrospinal fluid, first for bacteriological examination, second to determine the cell count and a biochemical examination, third on fallout web membrane, and sent to the lab. Transport the patient to the ward, shift on the bed. On patient, he must lie 2-3 hours. Feeding the patient is permitted 2 hours after the puncture in the supine position. Normal parameters of the cerebrospinal fluid in children. The cell count of the cerebrospinal fluid up to 3 months 20-25 cells, 3 months to 1 year 14-20 cells, 1 to years 11 to 14 cells, 1 to 5 years 10 and 12 cells, 5 to 10 years 6 and 10 cells, older than 10 years 2 and 6 cells. Biochemical parameters of the cerebrospinal fluid: sugar 2.5 and 3.5 millimole per liter, chlorides 120 and 140 millimole per liter, protein 0.33 gram per liter.